Hi, this is Dr. Strait, Dr. A. Vandiveer Strait of Wilton Dental Associates in Wilton, Connecticut. Um, our blog is Straight Talk, and we're all about preventing dental disease and making sure that all dental work lasts indefinitely. And in our practice, literally everyone who follows our program never gets new dental disease. Obviously, nothing is 100%, but we can show you how to be very, very effective and tremendously reduce the need for dental care, which will save you many thousands of dollars. Okay, today we're going to talk about irrigation. We talked last time about brushing and flossing, which are absolutely critical because what they do is they loosen up all the bacterial plaque. Now, plaque is very sticky, so you have to use mechanical measures to loosen them up. And you probably think when you brushed and flossed and rinsed your mouth with a glass of water, you did a pretty good job. Well, the fact is you did not. And the reason is that everyone, if you have teeth, has crevices around every tooth. Those crevices are fairly significant because that's what bacteria like. The bad bacteria like areas with not much oxygen, and the crevices are perfect for them. So they live right around that, and just slightly under the gum line, and even deeper down if there's deeper crevices around your teeth or pockets. Now you can't clean if it's very, very deep with any kind of mechanical method. And irrigation isn't going to solve every problem either, but it's part of the system. And the system is brush, floss, water pick, and then use an antibacterial. We'll talk about that next time. But this time, we're talking about how to rinse away what you loosened up with your toothbrush. So when you finish, you've packed a lot of bacterial plaque under your gums. And your gums are tight against your teeth. They don't just flapping around there. They're actually firmly against your tooth. And the pressure from rinsing is just not adequate. So you have to use something like a water pick. I mean, I use that word because now they're calling them water flossers, and that's a joke. Okay, because if that's the case, you don't need to brush either. But the fact is that irrigation is critical, and pressured irrigation is very, very important. There are a bunch of companies who make products that irrigate, and they're all good. One's Viajet, is one I know. There's one called H2O. In fact, there's a portable one that you can carry, when you travel, which I use when I travel. And then, of course, you have the ones you've seen everywhere. But it doesn't matter what brand you use at all. It matters that you're doing it. But I want to say there's some basic principles to it. Okay, number one, you must go along the gum line with it at right angles. You don't water pick straight up into the gum. Number two, if you haven't done it before, you start at a low pressure and work your way up. And you have to get to high pressure, because if the water irrigation device is not adequate in pressure, it will not work, because it will not push the gum aside enough to rinse out the crevice. So you have to brush with, do a good job of brushing, do a good job of flossing, and then you've got to go back with this water pick at high enough pressure, which we on the quote water pick companies or Teledyne's companies, we say is all the way up pretty much, 8, 9, 10. Okay? But every device is a little different, and we'd have to evaluate it if you're not using one of the ones we recommend. But the Viajet we recommend, the water pick we recommend, the H2O we recommend. Those are all high enough when you go up all the way. And the H2O is already set that way. So that's really critical for you to use one, because if you don't, those bacteria are repopulating your teeth instantly. And in addition, the periodontal aspect of your tooth is really not getting the care it needs. So if you want to stay healthy, you need all those three steps. If you need more help with this, please go to our website at wiltondental.com, wiltondental.associates.com, or call our office at 203-761-0223. Next time, we're going to talk about antibacterials, and there are some of those that are out there. And I think it's really an important one, so I hope you'll listen to it. And meanwhile, have a great day, and we'll see